Dr. Hilda C. Ong, ang programang tunay na serbisyo publiko na nakaka-touch ng puso. Health and Travel at Serbisyo Publiko, ang programang tunay na serbisyo publiko na nakaka-touch ng puso.
Nagpapatuloy ang paghahatid ng iyong agarang serbisyo, Lady Dr. Hilda Ong, ng tamang impormasyon at tamang serbisyo dito sa DWBL 1242 AM band. Ang Philippine Standard Time ay ganap ng 8:16 ng umaga, puwetiyam sa Blackhoon sa Aki. Madalas mo bang nararanasan na umiikot ang paligid mo o kaya naman patungo sa isang direksyon o parang kang sumasayaw sa paggalaw? Malamang ay hindi yan ordinaryong pagkahilo. Baka meron ka ng vertigo. Ito ay isang sense of motion. Dulot ito ng pagkalito ng ating utak dahil sa hindi pakakaparehas ng iniuulat ng ating sensory nerves, inner ear at mga mata. Walang aktual na datos kung ilan ang dumaranas ng vertigo, pero ayon sa mga eksperto, nararanasan ito ng 40% ng ating populasyon sa iba't ibang age group. Para pag-usapan ito ngayong umaga ay makakasama natin sa kwentuhan muli si Dr. Jonathan Zulueta, a specialist physiotherapist. At alam po ba ninyo ay talagang tayo ay pinagbigyan talaga ni Dr. Zulueta. At para ito ay siya po ay wala po sa Pilipinas ha. Magandang umaga, Dr. Zulueta.
Magandang umaga po. It's around 12 midnight po dito sa London.
12 midnight po? Saan po? Saan dyan po sa inyo?
Opo, midnight na po dito. Pero gising na gising po tayo sa programa niyo.
Tingnan ninyo 12 midnight kila doktora, tapos tayo naman ay nasa 18 na umaga. Talagang pinagbigyan tayo ng doktor, siya ang nakipag-adjust sa oras natin. Doktor, ang una, ang pagayan po, thank you daw, Doc Zulueta. Kasi yung namin na nanonood sa atin ngayon, siya daw ay may vertigo. Ano ba talaga nagiging sanhi o kadahilanan ng vertigo?
Ang vertigo ay isang simptomas na it fits on different conditions, no? Ito ay pwedeng nangyari sa brain mismo or sa labas ng brain. So ang tawag yan ay peripheral, which means outside ng brain. So may mga different causes ng vertigo tulad na tinatawag nilang BPPV or benign paroxysmal positional vertigo. Ito ay parang may mga crystal na accidentally lumabas sa pumunta sa mga canals ng ating tenga. Mga vertigo na symptoms are usually directed sa what we call vestibular apparatus, no? Ito po yung isang organ na sa loob po ng tenga, in the inner ear. Is one on the left and one on the right, so they are paired. Pwede ito ay magka-problema pag may infection or may virus din. The other reason ay pwede po ay because of stress. Ito po ay highly associated din sa may mga comorbidities tulad ng diabetes or lack of vitamin D, or mayroong studies na nagsasabi na pag may problema sa mga bone, associated din yung vertigo, which is very interesting. On the other hand, pwede po ito ay nagsisimula sa brain mismo. Minsan, pag after ng may stroke or may tinatawag natin may multiple sclerosis or one of that could be due to aging as well, could be cause of a vertigo. Yung mga medyo less prevalence ay sabi nila daw ay nasa neck din, sa mga buto ng leeg natin. So pag hindi natin, if we don't really turn po yung ating neck or yung ulo, habang we get to age, nagsisimula din yung pagtatawag nating hypofunction. Kasi po ang ating vestibular apparatus, kailangan gamitin po natin. Sabi nga nila, if you don't use it, you lose it. So pag na-lose it, nag-occur po yung vertigo. Mm. The other cause of vertigo, it could be due to migraines. Marami po sa atin na undiagnosed ng migraine. And then ito po ay nagsisimula po sa, we don't know what's the cause of it, pero mga simptomas po tulad ng blurring of vision, at tapos pag merong sila nakikita na gumagalaw sa
Oo.
paligid, or they see like checkers or stripes, nagkakaroon ng vertigo attack. Or minsan lights as well, pupunta ng, for example, sa bars or disco, and then there's like flashing of lights, and then when you go up to, let's say, to the ship or boat for a long time, tapos after a few days nagkakaroon ng vertigo symptoms. Ito po ay dahil po sa motion sickness as well, and that falls under the umbrella of vertigo.
At ano nga, Dr. Zulueta, ano ibig sabihin na ako ang hulugan ng vertigo is a symptom and not a condition?
It is isa siyang simptoma dahil madami siyang na-affect sa kondisyon. So it could be a symptom that you feel that you're spinning, or your environment nagsispin around you. Minsan nga, they will describe, it's rocking, or you're being pushed na minsan you're going to walk down the stairs, biglang someone pushes you back. So that kind of feeling. Or minsan naglalakad ka, tapos biglang doon ka pumupunta sa left side, and you don't know what happened. Okay? So these are like symptoms and signs and symptoms of it. Okay? And usually is associated on different conditions. That's why it's really important for us to know what's the cause of these symptoms, because the vertigo can fall in any other diseases. And once we know what the diagnosis is, it can be actually treated accordingly and effectively. Yeah.
Tapos kanina nabanggit mo, di ba, na ang vertigo ay hindi isang sign of aging lamang, maaaring din ito tumama o maranasan ng kahit sino. Siguro mas lalo na po ba yung sa mga sobrang stress, yung kulang sa tulog?
Yeah, there are some studies that because of stress, ang immune system na affect, and usually there is the immunity, the suppression of the immune system affects the certain nerves that supplies the vestibular apparatus. Pwede rin siya magiging aging din kasi when we go older, yung may tatawag nating hair cells, which is inside the vestibular apparatus, kumukonte na konti, which means that when it gets lesser, naging less sensitive yung vestibular apparatus. So let's say, the thing is, we have, di ba sabi natin, mayroon tayong paired na vestibular apparatus, one left and one the right side. Sa para siyang, pag let's say isa hindi siya nagagamit, okay, what is the problem? Actually, we can still function as young people, no? Pero yung mga matanda, kailangan dalawa. Oo. Kasi they have problems where to actually use, medyo, kasi parang pag young ka, nag-autopilot pa yun. Pero pag tumanda, wala na yung autopilot. Hindi na kaya na ng body. The other thing as well, pag tumanda, there's less also blood supply on a certain part of the area of the brain. So, for example, tinatawag nilang atherosclerosis, no? So, nagkakos na tinatawag nilang labyrinthitis. It affects the hearing as well as the balance organ. However, having said that, hindi lang siya pang matanda. It also occurs on different ages. For example, pag nag-trauma, pag tumama yung ulo, pag nahulog, tapos biglang, ay ano yan, may vertigo, it could be because yung na-dislodge yung crystal sa isang organ ng ear, pumunta sa ibang organ ng ear, and tapos nagkakos ng vertigo. It could be also due to lack of vitamin D, because the blood sugar as well, the diabetes is not well controlled. It's actually highly associated by it. So So there is a reason for aging. There's also, it could be also affect on different ages. In fact nga, 30% of the 60-year-old will have a form of vertigo. Pag nag-reach sila ng 80-year-old, it's around 50%, kalahati, will experience kind of vertigo symptoms. Yung faller, no, nahuhulog parati. Imagine 1 out 80% sa kanila, no, have a form of vestibular dysfunction. Ang problema lang nga, they're not diagnosed, but sila nahuhulog. And actually, we found out that 80% of that have a form of vestibular dysfunction. The sad truth is, one out of four is undertreated. We don't know why. So I think vertigo is common, but it's undertreated by us. Yeah.
So, ibig ko sabihin, Doktor, kasi katulad po, yung isang kaibigan ko na nasa Amerika,
Mm.
dating na niyang gawain yung kapag may bisita, nagpapalit siya ng curtain. Tapos ngayon na ang nangyari sa kanya, nung habang nagtatanggal siya ng curtain, bigla siya nahulog.
Mhm.
Ano yun? Meron na bang siya ng vertigo na hindi niya alam, kaya siya na off balance?
Because if you look at the anatomy po ng vestibular system, meron siyang tinatawag nating canals. Yung canals is orientated on different positions of the head. Now, the most common kind of vertigo is usually yung canal is orientated for that position. Yung description na tinatawag niya na bringing your head up. So tulad ng nag-fix ng curtain, okay? That kind of vertigo is usually common. Actually, 50% of that vertigo is actually accountable. Really, really popular, really common for that. And that could be, now, you will know it's a vertigo because the vertigo will last around 5 to 20 seconds. Okay? And then if that kind of that signs and symptom, it fits that kind of sa symptoms na yan, it could be what we call a BPPV, or benign positional paroxysmal vertigo, which is a crystal that's been dislodged. And the good thing about that is, well, I know it is sad truth because it can be really dangerous pag nahulog sila. The good thing about it, it can be treated quickly and it can be cured sa that kind of vertigo. The other kind of vertigo naman, kasi there are different canals, minsan when they turn over in the bed on one side, nahihilo sila. Or when they're bending over to, like say, they want to pick up things from the floor, the same kind of symptoms, parang spinning. So that's kind of vertigo that can be really treated. Pero may mga vertigo na ang hirap mag-treat, and that requires long term. Yeah.
Yan ang long term. So kaya pala, Doktor, minsan pag ako ay nagpapa-shampoo sa salon, siyempre talagang nakaganyan talaga, di ba? Matagal sila shampoo. Tapos pagbangon ko, sabi ko parang pagtayo ko, sabi ko parang medyo ako na off balance ba? Kaya medyo ako naging maingat ako pagka bangon ko. So yan ay medyo sign na rin yon.
Opo. Minsan po, minsan nagpapapunta ka ng dentista, pareho din. Kasi magkaganon ka ng ilang oras, no? Tapos pagbangon mo, biglang, parang medyong spinning kind of dizziness, no? Minsan, you will see, yung mata mo, pumupunta sa ibang direksyon. You won't notice it, pero kung meron kang ibang tao, like say dentista, they will notice it. Pero what you will feel is that you will see blurry yung vision. Kasi yung problema kasi pag nagkaroon ng spinning, you momentarily hindi mo makokontrol yung balance. So ang advice ko lang diyan is just you have to take your time. Pag nahihilo, dapat you have to sit down straight away. But what you need to do is find a specialist para iti-treat po yung vertigo, and then that can be actually cured. Pero just want to say, not all vertigo can be cured, but most of them can be treated. Yeah.
Ang sign o symptoms ng vertigo, ang isa ay yung iba nahihilo. Yung iba naman feeling like na kumbaga parang umiikot, 'di ba? Yan ang lagi kinikwento nila sa akin kasi hindi ko pa na-experience 'yon. Tapos ang sabi daw nila, Doc, ang turo daw nila dapat kapag once na humihilo daw, nahihilo ka, ang dapat daw ang mata mo naka-focus sa isang, let's say sabihin ang turo sa akin, naka-focus lang sa doorknob, huwag ka nang titingin sa paligid. Tama po ba 'yon?
Tama po yun. Kasi kung there are two types of vertigo. One, I said, outside the brain. Kumbaga, ang vertigo is in the ear. Pag mayroong klaseng vertigo na ganyan, pwede mong gawin, pwede ka tumingin sa thumb, no?
Sa thumb lang.
Oo, tapos i-fixate mo lang siya ng may isang minuto or 30 seconds to 1 minute. Pag there's no vertigo, ibig sabihin yung problema ay nasa labas ng brain, which is good, no? Ayaw naman natin. Pero kung hindi siya makukuha sa tingin, sa thumb, then that probably is a red flag that actually could be in the brain. And you need to go to a doctor really quick as you can, no? When situation comes to that, the best thing to do is to close your eyes. But you're right, doctor, yung unang mong gawin is tumingin po sa doorknob or sa thumb or fixate your eyes into something, okay? And that would really help. Pero yun yung unang management. Pero problema po yun, pag hindi po na ma-manage ng matagal, you'll be very dependent on that. And that's not the normal way to do it. But there's a way how to do it eventually. But right, for first aid, yun po yung gagawin natin. Opo.
So ang isa mga nakatingin dito sa Facebook. So dapat nakatingin ka sa ang mata mo, nakafocus sa iyong thumb.
Opo.
And then tama din po ba kasi iba ang ginagawa, yung pinipikit na lang nila ang mata nila. Kapag pinipikit nila, the more ba sila nahihilo?
So there rin po different stages po ng management of vertigo, no? Tinatawag po namin yan is vestibular rehabilitation training. So ang unang gawin namin we have to identify anong klaseng vertigo. Tapos kung yung vertigo ay makokontrol po sa tingin ng thumb, and then what we do is eventually i-close namin yung mata. Okay? Because it's not normal for us to fixate our eyes sa isang object all the time. Kailangan po, i-challenge din natin yung i-bring back po natin yung normal system. Minsan, ang vertigo ay nag-resolve din. 30% of them resolve for no reason, which is good. Spontaneously resolve. Ang problema lang, habang pinapabayaan natin, habang nag-resolve, we actually experience bad habits. Yung bad habits, ayoko nang tumingin sa ganyan. So you're trying to avoid things, which is not the way how to do it. Because in real life, we need to face the same routine and the same thing over and over again. So we don't have to stay away from it. Kailangan po i-manage po natin ng what we call graded exposure. Dahan-dahan until you become normal ulit. Okay? So yes, for those who have problems like stroke tapos na-experience ng vertigo, and actually po yung COVID, after a COVID, there are studies they have some vertigo as well. Kasi it affects the blood. Okay? And there is also a way how to treat them. So po sa friend nyo, usually po, ang ginagawa po namin ay meron po mga maneuvers how to put the head in one direction, and then eventually we'll spend 1 minute and then tinatawag po namin dyan Epley maneuver.
At pagka ganyan, let's say sabihin naka-vertigo siya and then nawala na. So dapat doktor, sino ang unang nila pupuntahan yun sa mata o dun sa ENT, sa tenga? Ano una nila ipapacheck?
I think po, una-una pupunta kayo sa doctor, no, to have it diagnosed. I would go po sa isang ENT doctor. Oo.
Sa ENT muna.
Oo. Ang tapos pagdating sa ENT, kasi ang practice po sa Pilipinas ay doctor muna bago po yung isang physical therapist. Okay?
Mm-mm.
Um, ang di ko lang alam kung gaano po yung training na isang physical therapist sa Pilipinas sa realm ng isang vertigo. I'm just talking to about myself that in here po, pwede po dumiretso po agad sa PT. Pero po by law and by healthcare law, kailangan po doctor muna to receive the diagnosis. Pagkatapos po yun, once the ENT po, ang doctor ay magda-diagnose, yung doctor na rin po ang magtitreat na rin kasabay-sabay kasi they're trained to do it. Ang 30% po ng isang after po na treat ng ENT, let's say na maneuver, they do an maneuver, among the elderly, they still experience vertigo, 30% of them. So kailangan po bumalik po kayo ulit sa doctor to review, okay? Unlike the young ones, like 20 until 40 or 50 years old, they get better straight away by having 3 sessions of the maneuver. So ang minimum actually po, twice, the maximum is 3. Kasi pag ang maneuver, pag ginawa yung maneuver, pag dalawang beses is around 60% effective. Pag ginawang tatlong beses, naging 90% effective siya. Pero kailangan gawin mo siya on separate days. Yun po yung ang sabi ng researchers, no? Pero for those who hasn't recovered yet, then they have to go rehabilitation na. Okay? Na tinatawag namin vestibular rehab therapy.
So, ibig sabihin, Doktor, ang vertigo mostly, ang problema, kumbaga, nandito sa may cause dito sa may tenga. Yung iba, nawawala ng yung hearing loss. Tapos yung iba naman parang may something, parang may nag-ring sa loob ng tenga nila. Yung iba naman pinapawisan. At mas worse po ba, yung iba yung nagsusuka na. So, ganito. Tapos yung mga iba, yung mahilig magkalkal ng kanilang tenga, isa na rin ako dyan. Ito din po ba, sa pagka nagtagal, nagkakakos din po ba ng vertigo yan?
Pag medyo, pag there is what we call trauma, pag trauma that causes to irritate whatever inside your ear, kasi nasa inner ear naman yung vestibular organ Pero pag na-affect yung middle ear, somehow nag-affect din yung infection will occur also in the inner ear. It's like po yung pag nag-swimming po ulit tayo like sa beach, medyo tapos nagko-cause po na what we call middle ear infection, okay? Tapos there are also symptoms na nagko-cause po ng balance, okay? There are also po pag yung naglalagay po tayo ng isang liquid po sa tenga, minsan we have to be careful with that kasi di natin alam kung gaano ka toxic. On gentamicin, I think that's the one, yeah. And then usually pag medyo if you go regularly, kasi dapat po moderate lang kasi yung iba they have to do it regularly. Ingat po lang tayo kasi nagko-cause din ng irritation ng vestibular organ. So yes, I think we just have to be we like, I think Filipinos, no, tayo naman we like cleaning, we like to clean ourselves all the time.
Ako lagi meron akong ganito, Doktor.
Ganun. Oo.
Yeah, pagka makatiyatinga ko, yan ang laging ginagalaw-galaw ko. Pero siyempre, isprayan ko muna na alcohol.
Oh yeah, pero wag po masyadong, don't push it all the time, okay? And I think it's about if you pull it, that's fine, I think, yeah. So yeah, yun lang po yung advice ko. There's nothing wrong in cleaning, but you don't have to push it harder.
At may nagsasabi, Doktor, para pwede siyang mawala, ay kailangan daw nila ng regular exercise. So, anong klaseng exercise para makatulong?
So, ang problema po ng isang vestibular, no, because ang ang anatomy ng vestibular, it connects to the brain. Tapos sa brain, it connects to other parts of the brain that controls sleeping, that controls your vomiting. That's why nagsusuka ka. Okay. And then it also controls your eye movement. So the first
Mm-mm.
exercise is to help to restore your eye movement. Unang-una, no? So yung unang-unang exercise, you have to look at your thumb. If you can see me on
Mm-mm.
Facebook, yun.
Mm-mm.
Tapos ang second, yung exercise na pwede niyong tingnan yan. Tapos you have to move your head side to side. Pero keep your eyes fixating sa thumb. Okay? So, kailangan hindi gumalaw yung mata. Kasi when the head moves, kailangan, tapos yung eye ang fixate. Ang tinatawag nila doon is called vestibulo-ocular reflex. Ito po ay nawawalan pag nagkaroon ng vertigo. So, kailangan po dahan-dahan muna pag-move ng head habang nag-stare tayo sa thumb. And then once you do that for 30 seconds to 1 minute, nakaupo 3 times a day. Tapos habang medyo okay ka na, as in, oh, kaya ko na to, you don't feel dizzy, then you have to increase po yung speed po ng ating head turning. Okay? Then eventually, do that for 1 minute again, 3 times a day. Tapos, pwede na po kayo tumayo. Tapos, gawin niyo po ulit yan. Okay?
Pero
Then,
doktor, yung mata, dapat, yung mata nakatingin sa thumb. Nakatingin sa thumb, tapos pag turn, nasa nag-turn, pero ang mata mo nasa thumb pa rin.
That's right. Tapos, ang progression po, ang speed po ng head turning, the more po ng head turning na speed, the better. Hindi lang head turning, that's also like, ano tinatawag natin dyan? Nodding, yung tawag sa Tagalog, yung gaganon. So parang nag-oo ka, di ba? You have to increase that speed. The same with that one. So from sitting to standing, tapos to walking. So that's one of the actually overused exercises na piniprescribe ko po sa pasyente. And then majority of them, believe it or not, they just got better. Tapos, the other one to practice is your balance kasi affected yung balance din. So, gawin niyo po, no? Pwede kayo tumayo, for example, tinatawag namin yan, bring your feet together. Tapos, after that, you can also bring one foot in front of the other. So, parang tinatawag namin yung tandem stand. So, ito po isang paa, tapos yung isang paa sa harap. Okay? Tapos, pwede po after that, pwede kayo mag-stand on one leg. So you're standing on one leg to get your balance. So you have an exercise for the dizziness. You also have an exercise for your balance. So they complement with each other. Okay? Pag medyo nahihilo po kayo dahil, for example, isang activities, for example, ay let's say, tumayo po kayo, tapos nahihilo kayo, one po ang gagawin nyo, no? You actually don't stay away from it. You actually you actually do it. So pwede kayo tumayo from sitting to standing. Tapos gawin yung 10 beses, 3 times a day. Tapos after 1 week with eyes closed, okay, sit to stand. Tapos ganun din, 3 times a day, 10 times for 1 week. Then the following week, dapat sit to stand. Tapos you move your head side to side. Ganun. So, tinatawag po natin dyan, habituation exercises. So, in order to treat the vertigo, there are 3 things that you have to do. One is called adaptation. Ito po yung tinatawag natin, yung sinuwa po natin, ganyan. That's adaptation, no? The second one, balance exercise. So, having your feet together and then standing on one leg. And lastly, ang habituation. Ito po yung vertigo depending po of the activity. So tulad po yesterday, no, meron akong pasyente na whenever he stands up, nagve-vertigo siya. So ang aking prescription is simple. It's just to let them to do sit to stand. Yun lang. Tapos you do that para what happen is ma-habituate yung brain. Because ang brain, for example, like you have to control the brain. Problema kasi ng vertigo, the vertigo controls you. Once the vertigo controls you, you became slave for them. In fact, you need to control the vertigo.
Mm-mm.
Oo, dapat ilaban nyo. Pero dahan-dahan lang, of course. Hindi yung nag-exercise ka tapos magsusuka ka. Well, that's too much. Dapat meron pong intensity. Ang intensity is between 3 to 7 out of 10. 10 is like ayaw mo na mag-exercise dahil susuka ka. So, pag nag-exercise ka, between 3 to 7 out of 10. That's the intensity. And then lastly, do aerobic exercise. So, kailangan po, you have to do walking. Ang kailangan po for older people, you need to have 150 minutes of physical activity per day. That means 2 hours and 30 minutes. Ang 2 hours and 30 minutes, pwede po kayo mag-brisk walking, or pwede po kayo mag-swimming or mag-running, okay? Yun po ay pwede pag aerobic po, it will improve the circulation around, okay? And habang naglalakad po kayo, you need to move your head, no? Kasi ang problema po natin minsan naglalakad din tayo, we just see from the front. Kailangan po we need to move our head. Pag gumalaw po yung head natin, the vestibular organ will be working. So once you use it, you won't lose it because ginagamit nyo. Okay.
Doktor, pag sinabi mo kanina na yung isang exercise, yung nakaupo, upo, and then stand up, tapos upo, ang mata niya saan nakafocus?
So sa pag tumayo, the eyes will be focused on one object or your thumb. You can do that. Okay? And then eventually po, you don't need your thumb because you just want to stand up. Kasi normal way of standing up, you don't really need to see something. Then eventually, you challenge it by closing your eyes. Or the other way to do it, for example, nahihilo po kayo habang you pick up things on the floor. So, ang simpleng gagawin, syempre, the same action, you have to pick up things. You have to face it, okay? But you have to you have to fixate something on the floor. So, pwede kayong kumuha ng isang ball or any object on the floor, tapos you pick it up. Pero ang vision mo, you have to look at the thing. Because the moment you don't fixate, that's where the vertigo happens. And then eventually, after 1 week, remove that object and try and see if it works. Okay? Pag nag-work, oh, that's good. Then the next week, try to close your eyes para walang fixation. So it's very graded.
Kapag sila naman ay natutulog, ano ang magandang posisyon?
So, kung yung vertigo ay yung crystal po ay nasa right side, I think you have to lie po on the good side. Okay? Now, there is what we call a neglect treatment, which means like if you lie on the good side, minsan po yung crystal ay pupunta sa tamang organ na doon siya mismo. Oo. So minsan 24 hours lang, ay okay na ako because you slept on the good side. Merong isang klase na pambihira, pero it occurs around 30% of that vertigo population. And that's a different case. That's why minsan you really have to look at what kind. Pero pag hindi siya nagre-resolve after listening from this talk, no, if it hasn't resolved for 2 weeks, I think it's time for you to go to an ENT. Okay? And then see. Kasi po, ang hirap pag may vertigo, it can be so disabling for other people. Ang nakakatakot lang baka mahulog sila especially pag elderly. Yun po yung magastos pag may fracture, di ba? And then kasi the implication of the disability is a lot higher than having vertigo. Okay? Minsan ang merong klaseng vertigo due to tumor. Yun ang nakakatakot talaga. Oo. And that has to be actually flagged up as soon as possible. malalaman din natin ang sintomas isang tinatawag nating nasa brain kasi hindi lang vertigo ang simptomas, no? Merong problema sa pagsasalita, merong problema sa memory, sa paglalakad, tapos sa vision as well. So dun po yung mismong kailangan pumunta po tayo ng hospital agad para po mapabilisan ang ating pag-treat at ma-recover from the vertigo.
At ang isa pa napapansin ko, bakit doktor bawal kapag meron kang gustong kunin na isang bagay, tapos masama din yung talaga ini-stretch mo sobra yung kamay, o talaga as in parang para makuha mo lang, aside from naiipit ang yung ugat, tapos
Ah,
may halong nagiging vertigo din po pa siya.
so there is I think that must be po pag if you want to reach for something and then
Mm-mm.
medyo po nagkakaroon ng stretch po ng yung ugat natin, no?
Mm-mm.
And that comes from the neck, no? There are structures in
Oo.
the neck that can cause to have to tighten it. So tulad po ng isang compression ng certain muscles or ang ribs natin medyo po umangat tapos na-compress.
Mm-mm.
Pero normally pag tayo ay if we want to reach something, wala naman tayo yung we don't have any symptoms at all. But for those who have symptoms, it could be po there is a problem in one of your nerves in your neck
Mm-mm.
that may have compression or certain muscles that's very tight as well. Minsan hindi lang po yung nerve, no? Kasama na rin yung blood vessels natin. Minsan you will feel like a toothache pain, parang namamaga ang simptomas sa kamay kasama yung radiating pain and numbness and pins and needles. Ay,
Mm-mm.
there's another way as well. I forgot to say ang isang klaseng dizziness, no, ay galing sa leeg. Ito po
Mm-mm.
yung um, pag may medyo masakit po yung leeg natin tulad sa arthritis, or medyo po na-aksidente po tayo sa isang kotse, tinatawag natin whiplash injury, okay? Or nahulog po natin, natamaan yung leeg, tapos nagkaroon ng dizziness, ito po ay isang part, ito ay under umbrella po nila. So ang pag-treat po dito ay kailangan pumunta din sa orthopedic doctor, no? Para i-clear. Kaso lang minsan ito klaseng simptomas is share din tulad sa ENT at neurologist. So that's
Mm-mm.
why sila mismo nag-uusap kung anong klaseng simptomas to. Pero ang matitreat po dyan natin ay from my side as a physical therapist ay traction, tapos po ginagalaw po namin yung muscles para to make them relax. Tapos eventually po, we will want to get that muscle stronger. So ito po, lahat po ay very disabling, whether what kind of vertigo they are occurring under your brain or outside or your ear or your neck. Ang problema po pag hindi natin treat, we actually have some bad habits, and these bad habits, ito po yung ay nagkakaroon ng problema sa every day on what we do. So we try to avoid things. Dapat nga kailangan we have to be back to normal. So dapat po ang awareness natin sa treatment ng vertigo tulad ito sa itong programa ay isang a good way to do it kasi there we can do something about it. Yeah.
Mm. At ang isa, kapag may vertigo ba, tama ba sinasabi nila na ito ay takot sa height, yung masyadong matataas?
Yeah, because there's nagkaroon ng problema sa perception ng brain, no? And there's called a dysfunction. Ako, I have to be honest, takot ako sa sa height mismo din. Pero ang pag tumitingin ako sa baba, ang ginagawa ko, I put my thumb down tapos
Mm.
yung pina-focus ko, it really works. Oh, mis-
Mm.
minsan nga there's another type of vertigo tinatawag na is visual vertigo, or the new term now is called visual induced dizziness. Ito po yung isang klaseng vertigo. For example, nasa na sa beach ka tapos nakikita mo yung wave and then people will feel sick, motion sickness, no? Or people will just look at the, let's say nasa isa kang park, walang kahoy, o walang trees, plain lang, tapos nahihilo sila, okay? Or minsan nakikita mo yung habang na you're standing up, naghihintay ka ng ng jeep or isang bus, tapos gumagalaw yung mga tao, nahihilo kayo, okay? Ito po yung ay isang klaseng motion type of dizziness. The way you treat po dito is almost the same. Ang added treatment lang dito ay kailangan po you have to be very creative on what you do. So tulad po sa ginagawa ko po sa London, ay for example po meron akong pasyente na hindi siya makapupunta ng grocery dahil ang shelves nag-occur yung ng vertigo. So ginagawa ko ay pinapapa-YouTube ko sila. Oo, tapos pinauupo ko sila sa isang ball. Tapos ang prescription ko po sa kanila ay tumingin po sila sa YouTube na isang grocery 30 seconds a day. Then eventually, i-increase po nila yung duration. So, meron po ang tatawag diyan po natin graded exposure. Meron po isang dizziness po, meron akong pasyente, model siya, hindi siya mapaglakad sa ramp dahil sa lights. So, nahuhulog siya. Pupunta siya sa left. So, ginagawa po namin, meron po yung tinatawag namin phototherapy where ginagamit po namin light therapy. Tapos dahan-dahan lang namin pinapa-implement yung light habang nag-improve yung symptoms niya. So, ang what we can take away from here is that there are exercises po, no? Minsan po biniblame natin dahil ito po ay simptomas na isang aging. Kadalasan po hindi po yung totoo. Meron pa tayong pwede nating gagawin. Pero po kailangan pumunta po kayo sa isang professional na may experience po na pwede i-treat yung vertigo.
Doktor, ano may papayo po ninyo? Kasi during the pandemic, 'di ba 2 years, maraming hindi lumalabas ng bahay. Talaga o kaya naman pupunta lang sila, kumalapit lang kanilang bahay papunta sa opisina, less than 1 kilometer. So hindi talaga sila lumalabas, parang nakakaroon ng anxiety attack na. And then, sabi ko, lumabas na kayo, nasa alert level 1 na sa kotse. So, ang nangyari, kapag sila ay sumasakay ng sasakyan, ang unang complaint nila ay talagang grabe daw ang hilo nila. So, pagka ganito, anong dapat nilang gawin?
So, isang part yan is anxiety and stress because doon they feel secured po sa bahay nila. Then eventually, naglalakad. So, ang gawin natin, you can do some breathing exercises, okay? So, we also recommend meditation, okay? So, the meditation will help to reduce the stress hormones. So, or you do your breathing exercises. Yung breathing exercise, very, very simple, pero it's very underrated. Ibig sabihin, maraming may alam, pero ang daming hindi alam na isang malaking tulong sa isang, tsaka libre ang breathing exercises, walang medicine. Okay, so what you do, you have to inhale air into your nose, tapos dahan-dahan, you have to exhale out your mouth for around 4 to 5 seconds. But you have to do it 5 times para po bumaba yung stress hormones. Okay? Now, pag let's say, so that will help. Pag ayaw pa rin, and then we can do something like behavioral therapy. So, kailangan pumunta, you have to create change po sa behavior ng isang tao. Ito po ay ginagawa po ng psychologists para to overcome the fear. Okay? So, ang doctor, ang physical therapist, ang psychologist, ito po yung tatlong tao that will really help you a lot to alleviate the fear at the same time to get you stronger. Tapos, ang doctor naman, you will provide some kind of like medicine just to reduce
Mm,
the kind of dizziness. Meron minsan
mm,
ang vertigo medyo malakas. Medyo we want to reduce it. So that's where the medicine is coming to help. Okay?
mm,
Pero kailangan huwag nating maging dependent sa medicine. We really have to
mm.
treat it kasi unang-una ang medicine, most of them are suppressants, and most of them will just try to alleviate. It doesn't really help to control. Pero there are vertigo that requires long-term medication as well. Okay.
Doktor, ano ang may papayo mo sa ating mga nakikinig sa atin ngayon at syempre po sa mga nanood at next time siguro tutukan din naman natin kasi dati ang ginawa natin halos lahat ng topic
Oo.
pinagsama-sama natin.
Opo.
Dahil today puro ang topic natin nakatutok lang sa vertigo. And then susunod naman tayo ng comment ng ating mga listeners ko ano ang suggestion nila. At ako'y hihiling ulit sa inyo na hindi naman kayo makakatulog ulit, Doktor. 12 midnight, nandito ka sa radyo.
Okay lang yun po. Ang takeaway ko lang po sa ang vertigo ay isang simptomas na pwede po ay nangyayari sa different ages, okay? But mostly po sa isang elderly. Ito po ay pwedeng spontaneous nangyari or nangyari because of another reason, okay? And then it could be actually treated po, okay? There are vertigo na medyo disabling na ito po ay medyo kailangan na itulong po ng isang doktor tulad po ng isang ENT or neurologist. Kami po within sa field po ng isang physical therapist, ito po ay sabi po nila ay bago-bago yung role. And actually po, ito po it has been existed for a long time. Sa mga colleague ko po na isang physical therapist, we do have po ng association and maybe we can actually sell it out so that ito po ay isang malaking tulong din sa ating community as physical therapists for the Filipino people, no? The good thing about the vertigo, it can be treated, okay? And merong management po na nalilay na we can do something. And there are advices as well that you can actually help yourself by reducing the chances. Una-una po ay exercises, okay? Do your aerobic exercises as well. And then, wag po kayong matakot gumalaw, umikot po you turn your neck, turn your head, because that's where your vestibular system works, okay? Remember, if you don't use it, you lose it, okay? All right.
Muli po, ang nakasama po natin ay si Dr. Jonathan Zulueta, isang specialist po, physiotherapist po. Siya po ay naka-home base po ngayon sa London. At talaga ito ay special na talagang panayam ko po talaga sa special request at tayo ay nakipag-ugnayan sa kanya. Maraming salamat po, Dr. John, sa
Sige
oras
po.
na ibinigay po niyo. Hopefully, makasama ka namin muli.
Sige pa.
At sa
No
mga
worries.
hindi po nakapanood kanina o di nyo naumpisahan, ang aming dito po sa usapin tungkol sa vertigo, pwede po ninyo tignan sa TV Radio Hilda Ong ang itong replay o kaya naman pwede naman din nyo panoorin po sa YouTube vlog po na Hilda Ong. Kaya ako po magpapaalam na po sa inyong lahat. Maraming salamat po sa pagtutok po ninyo sa Lunes na edisyon ng Health and Travel at Serbisyo Publiko. Bukas po at ang magiging topic po naman natin ay tungkol po sa SSS. Dahil nung Friday, alamin natin bakit ang daming mga SSS pensioners ay pumunta po sa sa branches, lalo na po sa Diliman. Yan po ay alamin natin po bukas kay Sir Fernand Nicolas. At muli po, ako po magpapaalam na po dito po sa DWBL, dito po sa radio. Sa mga nasa Facebook po, dyan lang po kayo. Thank you so much po sa inyong lahat. See you again po tomorrow. Good morning, magandang umaga at sa Shanghai. Bye!
Health and Travel at Serbisyo